today we will talk about a couple of diseases which are not so treatable by the modern science, but homeopathy has its own approach. So we are going to talk about ophthalmic diseases, retinitis pigmentosa and macular degeneration. So let us speak about retinitis pigmentosa. What is retinitis pigmentosa? It's actually a kind of a genetic disorder which affects the retina and how it responds to light. Because of which, initially there is a low vision and it can be nyctalopia, peripheral vision will get affected, and there is a mild blindness that starts. So, what basically happens pathologically, and you can see here the rods and the cone cell, they get destroyed in this particular manner. This is the normal retina, and this is retinitis pigmentosa. And what often happens in retinitis pigmentosa is that the vision will become like this, what you call clinical ophthalmologically as tunnel vision. And this is how a patient with retinitis pigmentosa will see. He will see his entire life like this. The other illness I want to speak to you about is macular degeneration. This is often age related, but it can often happen at a little younger age. What happens here basically is there is a fat deposition in the eye, especially under the retina. You can see here, because of which there is a blurred vision. Now, macular degeneration is very common, especially in India. It is very common, especially with diabetes. So often there will be a loss of central vision, something like this. This is a little opposite to the retinitis pigmentosa where there is a tunnel vision. Here there is a lot of central vision. They often call it as a central scotoma. And there are different stages. There is the early stage, intermediate stage and late stage. Now, in all these cases, homeopathy has tremendous kind of results. Now, the results vary depending on which stage the patient comes to homeopathy for. At an early stage, very often homeopathy is able to make sure that the degeneration kind of reduces. However, once in intermediate stage or late stage, homeopathy can help to stop the further progress of the disease. It cannot reverse the condition, but even if we can stop the further progress, it is remarkable, and this is not possible by any other science. This is the beauty of homeopathy. So I like to share with you one of very interesting case of retinitis pigmentosa. A very young girl, 25-year-old girl. So let us see the case. So this is the case. She's a girl. Her major issue, and you can see here clinically the reports. Very interesting. You can see the retinal thickness. Okay, was 91 micrometer. Interesting. Of one eye. Of the other eye, the retinal thickness was 67 micrometer. Okay. So it is also interesting for homeopaths to know how to read this kind of ophthalmic scans, the eye reports. Very interesting. Retinal reports. So you see here, this is what is called as an OCT image. And there is a very important thing here written OD. OD means basically right eye. So OD stands for ocular dexter, which in Latin means right eye. So whenever you see OD, it is the right eye. And when you say OS, means the left eye, which in Latin means ocular sinister. This means the left eye. So it's also important in homeopathy. If you want to do something really at a higher level, you should know a little bit of clinical science. So this is the situation with the retinal situation. So for last 7 years, this young girl is having dim vision. It started with dim vision and then developed tunnel vision. Her major issue was, especially at night, she would find it very difficult to see. Even at night, there would be difficulty in walking. She wouldn't be able to go without light. This would affect her a lot and she would get very tensed and worried. So here in homeopathy, we don't stop only at what are the symptoms of the eye. We try to go deeper and try to understand how it started and what was the symptoms when it started, the origin, duration, progress of the disease. So here, the origin of the disease was as follows: that 7 years back, she developed a lot of warm waves from the eyes, constant warm waves, and a feeling as if some insect is there in the eye. So what she would have to do that time, she would have to put a lot of water on the eyes. That would make her feel a little better. Also, she would develop a lot of sinus and coryza, and whenever she would develop this sardi and sinus, whenever blowing the nose, she will develop this vision deterioration. Even weather change would affect a lot. This is when I tried to go a little deeper and understand her state of mind. And she described herself as someone who is very, very sensitive, especially to any statement that anyone made about her. And her reaction was that she would keep everything inside and she wouldn't share her emotions much. When I asked her about stressful situation, she described her stressful situation as especially when her father treated her badly and there was a dejection from family. It affected her personally, and initially, the confident, passionate woman in her, she developed a lot of disappointment and she started going much more in a shell and stopped reacting and speaking to people. When I asked her about stressful situations, she said one of the relative expat, she took the entire responsibility of the entire house on her. And she kind of did it in a very nice way, but still people never appreciated her. This affected her a lot. When I asked her about her fears, there was nothing particular. But one very particular thing was that whenever there would be damp weather, it would affect her, especially even her vision. So this is the situation where there are some mental symptoms, some general symptoms, stressful situation, and we see her personality coming out. So when I analyze this case with a repertory, it's very important to know that homeopathy acts at an immune system level, where the remedy that we give will help so that the pace of the disease can stop down. So when I analyze the case and repertorize the case, you can see here I've done. I took the following rubrics: vision washing of the eye ameliorate, blowing the nose vision aggravate, sparks and glittering after nose. And you see a lot of remedies here: asaram, natrum sulf, alumina, causticum. On analyzing a little better, I saw that eyes formication crawling, insect like, eyes heat washing over it, and steam out. The only remedy that came out was natrum sulf. On studying her mind symptom, she described herself as very, very emotional, sentimental, and especially sensitive to what others say about her. And she also described someone with very, very high responsibility. Here, if you study, the remedy that came up was natrum sulf. So, at the local level, at the vision level, and at the peculiarity level, and even at the mind level, we know very nicely that damp weather aggravation is often a keynote of natrum sulf. This kind of close personality and a lot of disappointment also often gives you a pointer toward natrum sulf. So natrum sulf 200, we have started one dose every month, and I have followed her up for couple of years. Every month we would evaluate, sit, study her evaluation again, and we did a follow up with the eye scan after 2 years. And there was a remarkable change, not just mentally, where she felt much more calmer, relaxed, and was able to take her life decision in a better way. Now she's married, but even in the reports, which I would like to show, the the OD and the OS, both the eye symptoms, you can see very nicely here. It's given that you can see the OD became from 90 to 111, OS from 60 it became 101. So actually, it was shocking for me to know that her retinal thickness, instead of reducing, it increased in size, because of which her vision, which was deteriorating very fast, it really improved a lot. So this is what homeopathy can help you. And I remember just another case which I did recently, a case I did from a actually this is a case of homeopath from Tamil Nadu, and his main symptom, this is a case of macular degeneration, was that he would constantly feel a kind of blackness in the center with nothing outside. So when I studied his main symptom in Patak repertory, it was vision blindness progressive with central scotoma. And there were many remedies there, 5, out of which the remedy I gave him was carbonium sulfate. Also, he had other symptoms of carbon and sulfur. So, interestingly, you can, with homeopathy, if you understand the case in detail and find an individual remedy, it can help. However, along with homeopathy, there needs to be a lifestyle change. One thing I often ask my ophthalmic patient, and often many cases of autoimmune or genetic disorders, is to ask to stop sugar in all forms. Healthier food will help. Eye exercises often help. Meditation, yoga, this together with homeopathy can often help. So you can write to me about your thoughts, and if you have any thoughts, suggestions, difficult cases, you can write to me.